Welcome to Generous Impact. I'm your host, Amanda Brummitt. I first met today's guest, Dr. Mary Faria, through National Association of Latino Healthcare Executives, and I'm so grateful to share her story with you. Mary has been serving the Austin community for decades, and one of her most impactful roles has been with the Austin Mayor's Health and Wellbeing Council. This nonprofit organization, in partnership with Austin Public Health, has been supporting the health and fitness of our community for more than 21 years. Mary has been involved since its inception and even served as board chair for 7 years. Let's get started. Mary, thank you so much for your time and for being here with us today. We know you're a very busy woman, so always appreciate when you can carve out a few minutes for us.
Well, I'm happy to do it.
So let's just start with your background. Who are you personally and professionally?
Well, born and raised in Houston, came to Austin in the 70s as an undergrad at UT. And where I met my husband and we married on campus. So UT is a special place to me. So it's fun that now I'm gone full circle and I'm teaching at UT. So
yeah,
it's been really fun. But I started my career as a respiratory therapist. And in fact, I did that. My husband's career, I was following his career. He's an engineer, was an engineer. He's retired now. I should be too, but I'm a failure at retirement. I followed him, and we were in West Texas, and there really wasn't anything for me to do with my bachelor's degree. They didn't have any graduate programs at that time, but there was a community college that offered a lot of allied health programs. So I decided to supplement my degree with a degree in respiratory therapy, and that's how I got into healthcare. So I started as an ICU therapist and a diagnostician, and I've just been so blessed. I've just had so many opportunities that have been given to me throughout my career. So I, started as a therapist, but then I loved diagnostics. The person who ran the diagnostics lab at the first hospital I worked, which was Midland Memorial, he recognized how much I liked the diagnostics and, so encouraged me to come to the lab when I had time off, and I always did that. And then a position opened in Odessa because Midland is just their sister cities, and in Odessa, where we were living, the Women's and Children's Hospital had an opening, someone to start a pulmonary lab. So this person that had been mentoring me, he said, you know what, there's this opportunity and you need to take it. I said, I'm not ready. And he said, oh yeah, you are. And he said, I'll be your reference. But that launched my career as a therapist, but also as a manager, because the role included overseeing the respiratory therapy department as well as starting this pulmonary lab. So then, we were there for a few years, and my husband was offered an opportunity in Houston. So we moved to Houston for a short bit, and then to Austin. And in Houston and Austin, I stayed with a for-profit healthcare chain that offered me positions in both cities. When I came to Austin, I decided to go to graduate school, got a master's in healthcare administration.
Wow.
Right at the end of that, as I was finishing up my master's, one of my professors offered me an opportunity to work with him on a project and at his community hospital. And so that led to me spending 7 years as the, essentially, they called it at that time assistant administrator, but it was the chief operating officer for this 250-bed hospital. So it was wonderful foundation for me. And the man I worked for was a fabulous mentor. He had been the administrator at Brook Medical Center for years. Everyone knew him when I would travel through my professional group, ACAG. And then I decided, one thing led to another. I was offered an opportunity to work for a pharmaceutical research company. I'd been with the hospital 7 years.
Oh, wow.
And someone who had worked for me reached out to me and said, hey, we have this opening at the pharmaceutical research company where she was working. So one thing led to another. I got hired there to oversee their phase 1 facility in the drug research. And I was there for 4 years, and it's a tough environment. And then out of the blue, someone I had done work with through ACHE committee work, she reached out to me about a position she had at Ascension Seton. So I went there, and I was there for 23 years and retired, and then went on to, when I retired, pulled out of retirement when a physician that I had worked with invited me to come, and she knew I was passionate about integrative care. She was as well. She was serving as the president of a graduate school of integrative medicine, and brought me on as the CEO, and then with the plan for me to transition into the president's role as she retired. Well, that's what happened. And then one thing again led to another, and I was there for almost 7 years, and again ready to think about just seriously retiring
Mhm.
when from UT reached out to me to consider teaching at McCombs, and that's what I'm doing now.
Ah, that sounds amazing. Wow. I didn't realize that you started out on the clinical side. I love that. That gives you such a good
Oh yeah.
just a good lens to look through.
Well, and I believe that administrators who, especially hospital administrators who've had some frontline experience, really understand. And they really, it makes such a difference. Physicians make great administrators because they have that clinical perspective. It's been good. I while at Seton, they supported me as I got my PhD in 2000 with the intent of teaching, in retirement. So I'm doing exactly what I had planned to do a long time ago.
Perfect. And then let's back up again and tell me about the Mayor's Health and Wellbeing Council, which was, I know it started a long time ago and you were there at the beginning. So tell us about it and what drew you to it.
The council was formed when Will Wynn was mayor of Austin back in, gosh, so 21 years ago. And it actually began because Will Wynn had read an article in a men's magazine that was rating cities in terms of fitness. And San Antonio was at the top of the list. And it infuriated him. It infuriated him. He said, there's no way San Antonio is healthier than Austin. He brought some key people together. Paul Carosa was one of the key people who was the founder and owner of Runtex in the day. Lou Earl, who was the founder and owner of Austin Fit Magazine. And those three and Will Wynn were the instigators of the Mayor's Health at that time, the Mayor's Fitness Council. It was just the Mayor's
Mm,
Council. It's evolved over time. It was the Fitness Council, then it was the Health and Fitness Council, and then now it's the Health and Wellbeing Council. So, which appropriately now includes that mental health piece. So, when Wilwin was trying to grow the council, he went to different key organizations in the community, and especially the healthcare organizations. So, or an organization like Seton was asked to provide a representative of the organization to serve on the council. Well, everyone knew at Seton that I was a competitive runner, and so they chose me to be the representative to represent Seton on the council. And that's how it began. That's how I got involved. And so have been serving all this time, served 7 years as board chair. I think we've done a lot of great things. We've accomplished a lot over the 21 years.
yeah. So what does the council do on a day-to-day basis?
So part of the council is the Austin Business Group on Health.
Oh.
Yeah, so we have this umbrella, the Austin
Mhm.
Mayor's Health and Wellbeing Council, and that has the Austin Business Group on health as part of the organization. Then the work that's being done, there are several committees, working committees. The committees are intended to help the key aspects of the council move forward. The best way to describe it, there are programs now that are in place, that have been in place. So
Mm.
Austin Business Group on Health was the organization that is there to support small businesses. And they offer free education, free opportunities for networking, some really outstanding education for small businesses around health and well-being for their employees.
Nice.
Then we have these partnership programs. The first partnership program was with businesses. If you're to become a certified partner, you have to meet certain standards. You have to commit as an organization or as the leadership of an organization to certain standards that are expected with regard to your employees. So you're encouraging healthy eating, you're encouraging physical activity, you're encouraging mindfulness. All of those things are important. And there are certain, you've got to demonstrate as you achieve your certification and continue the certification that you're continually keeping up with these standards and that you're continually helping your employees stay healthy.
Yeah.
So that's an important piece, but that's business focused. Well, we decided that we really needed to go beyond just businesses. Businesses, we've had wonderful success with business participation. But then we said we really need to get the schools involved. And so there's a partnership for schools at all levels, elementary, middle school, high school. But it's the elementary schools that have really been passionate about participating. And it's so wonderful to see it that has grown. So the same requirements for them. Schools have to demonstrate that they're doing work to help kids eat better, stay more active, be more mindful, be more centered. So that's another one of our partnership programs. Now we've gone one more, and I'm so excited about this because we started this several years ago. And so we work hand in hand with Austin Public Health. So everything we do, we're doing with Austin Public Health. So Austin Public Health actually has someone on their staff that is dedicated to working with the churches and faith-based communities within Austin. And she's done a fabulous job to recruit churches to participate. So same thing, the churches have to demonstrate that they're helping their community, their church community, stay healthy, eat more nutritious meals, stay active, stay centered. Being in a church environment, that's a natural one for them. So it's been great to have the churches, and we don't have a lot yet. That's growing. That's still growing because it's still fairly new, but it's exciting to see. So then each year we have an annual awards ceremony. And at the awards ceremony, it's gotten so large because we do it at City Hall that we've had to split the awards. So this year, this year we recognized schools and faith-based organizations. And then last year and next year, we were recognizing the businesses and the school districts. So it's been great. And what happens at the awards ceremony, if these organizations are doing some really, really innovative work, and they are, it's amazing. Especially, I have to hold out the elementary schools. They have done such creative work to help kids think differently about their health. And they win a monetary award, and they get as much as, as little as $400, as much as $1,000 to reinvest in their wellness programs. They have to demonstrate that they're reinvesting it to continue the work that they're doing. The council is, the way we're able to do the awards is by getting sponsors to help us to finance that. The organization is completely run by volunteers. Now, the Austin Public Health employees, of course, are employed by Austin Public Health, but everyone else, it's voluntary. We don't have an executive director. We don't have any paid employees. So all the money that we receive goes for basic things like the website, like if there are any food costs for a special meeting or something like that, but no salaries that we're paying. It's a true not-for-profit organization. But yeah, it's been great. Now I'm very excited about I've been passionate about. How do we help the council and with Austin Public Health? Because some of the most important work we've done, for example, I think one of our biggest achievements with Austin Public Health has been that Austin is now a city where you can go to any bar, any restaurant, just about any environment and be smoke-free.
Yeah.
That was a tough one. That was a policy change. And we feel very strongly that it's policy that can make a difference in changing health. So as I was thinking about it recently, at these award ceremonies, Austin Public Health brings forward data.
Mm-hmm.
And the last 2 years have broken my heart because we have worked so hard in this community to improve the health of our community. And yet all of the measures, the key measures, are going in the wrong direction. Right now, last year, we were seeing 60% of our population obese or overweight, which leads to all kinds of other chronic issues. Mm-hmm. This year, we're at 64%. So it's gone up. It's continuing to rise. Just, I couldn't believe it. I have to do something about this. Plus, the other thing that shocked me, the data on life expectancy between East and West Austin. It's 18 years. Unbelievable.
That is so sad,
So sad.
unacceptable.
And
Yeah.
we've got to do something about this. So
Which if any of our listeners aren't from the Austin area, east of 35 looks one way, west of 35 looks very different. Massive demographic differences and disparities that are not okay.
earlier in the year, I put together a collaborative and brought together some really key stakeholders, including leaders from Austin Public Health and others in the community. And we started on this journey at first just because I have a colleague in Finland who's doing this amazing work with technology. And I believe technology is part of the solution. So he's been part of this collaborative as well. And as we've met, the first many meetings were just kind of brainstorming, how do we attack this? It's a huge issue to address. And but there's got to be an answer. There has to be. So I said, if we put the good minds together, we're bound to figure out how to start attacking this. And it's interesting how things come together. And this group has been amazing with some of their ideas and some pilots that we want to do in the community. So, but I thought, we're just an independent group out here trying to do something good. So I really thought this ought to be the work of our Mayor's Health and Wellbeing Council. So why not
Yeah.
this one of our committees? So that's what
Right.
they do. So this kind of work's going to be incorporated under the umbrella of the Mayor's Health and Wellbeing Council. I think that'll help us to be able to access some dollars that we might need for grant funding or something like that. So I'm excited about
Absolutely.
that. I'm excited about that, hopefully. And then as things happen, I'm teaching one of my classes at UT. I teach is healthcare systems management class,
Mhm.
and the students have to participate in a project that's health related and business related.
Mm.
And I go out and I get businesses who are interested in sponsoring a team that will help them in some way. And they have a very specific project. The students have very specific deliverables for the project. So I got to thinking, I told the group, how about if we have a student group help us with some of this? Because we're back to policy and looking at policies. And Austin Public Health said, we've got policies, but they need to be reviewed. They need to be prioritized. I said, okay, I think a student group would be perfect for that. So one of my student groups is actually going to be supporting us this term and helping us as we're so I think some good things will come from that. But yeah, so it's
Yeah,
interesting how everything kind of comes full circle.
definitely. So it sounds like the smoking is a huge impact you guys have had.
Mhm.
And even despite some of the metrics going in the wrong direction in the last couple of years, are there some other things that you're really proud of or things that you want to celebrate that you guys have done?
Oh, I think when you think about all of the businesses that have jumped on board, all of the schools, all of the faith-based organizations, so you're not, it's not just the groups directly related to those organizations that benefit
Mhm.
the families of every one of those people. So it's, hundreds of thousands of people that are being impacted. And that's to me a tremendous success. And even if they just
Mhm.
change one thing in their lives that makes them a little healthier, that's a
Mm,
success.
definitely. Most definitely. So, Mary, you give back a ton. You volunteer with the American College of Healthcare Executives, National Association of Latino Healthcare Executives, USA Track and Field, Concordia University's Healthcare Advisory Board, St. Augustine's Community Advisory Board. When you look at all of these organizations and where you choose to spend your time, what what are you doing to help create an impact that outlives you?
I think if in any of these organizations that I'm involved with, I can help them be successful. They're the legacy, the success of
Mhm.
those organizations and the work that they're
Mhm.
doing. Yeah, I think that's the most important thing.
Yeah, yeah, that's a beautiful impact. And then on the Health and Wellbeing Council, so you mentioned the project to remove some of those disparities. Are there other things, Mary, that are coming for the council that you can share?
I think this work we're doing it in the collaborative and bringing that in the council, that will lead to more work like that.
Yeah,
That will allow the council to really have an even bigger impact in the community.
right. Agree. Yeah. And then what about yourself personally and professionally? If you know, are you going to retire again? Are you going to fail retirement again? What's next for you?
I don't know. God,
Are you going to run another major marathon?
yeah, that's always part of my life. So yeah, I'll be doing New York in November, New York City. Yeah.
Oh, fabulous.
I was invited. I qualified for the age group world championships. So when I did London, and then I qualified again in Tokyo in March,
Uh,
which I'll do at Cape Town next year. But yeah, so I've always got a race out there, a marathon out there for. Usually it's one a year. I did two this year, and that was an exception. But I didn't want to miss New York. I haven't done New York since 1994, so it's going to be fun to go back.
yeah. I was wondering since Berlin was yesterday, I thought, oh, is Mary going to be dialing in
I
from
did that
Germany
year
today?
before last, and three of my friends were there, and I had a great time.
Nice. Very nice. So, okay. So more marathons in the future for you. And then,
Always, yeah.
yeah. And then do you think you'll keep teaching or will you?
I think so. I recognize one thing though, that I want to spend more time with my husband too. I mean,
Sure.
I am married to the most wonderful man and have been for it'll be 50 years this year. And
Oh,
I just I recognize that, he's having some health issues, and I'm thinking, gosh, I really don't want to miss out on any time with him. And school does, keep me away from that. But I love it too. So it's hard. And he wants me to do the things that make me happy. So he's always been supportive of everything that I do. So yeah, I don't know. I don't know what my plans are yet. I might drop to one class instead of two because I never intended to teach two.
right.
But yeah, it's it's a tough decision because
Yeah.
I'm not one to, just want to sit around.
Right. Which is inspiring to the rest of us. I hope that we can all be more like that. And in that vein, what or who inspires you?
Gosh, I'm inspired by so many people. But I'm inspired by, when I think about groups that I've been able to be involved with through the Mayor's Health and Wellbeing Council. There's a wonderful community in East Austin called the Blacklands. And one of the community leaders, I got to visit with the community and visit with him and see the work that they're doing. I'm inspired by people in the community that are just doing creative and innovative things at low cost to help
Hmm.
their surrounding community, whatever that may be, whether it's their neighborhood, whether it's, part of the city, whatever that community is to them, they're making such a difference. And it's amazing. But I'm also inspired, like teaching. I have been blown away with my students. They're the future. Most of my students are pre-med. A lot of them have minors in health reform and innovation, which is a minor that McCombs Business School offers. And I'm inspired by them and their passion for wanting to change our healthcare system, which desperately needs changing.
Yes. Yes, for sure. Well, Mary, if people have listened to this and they feel excited about the Health and Wellbeing Council, how can they get involved? How can they support the movement? What do you need?
There are so many ways they can get involved. One basic is if they want to help sponsor us, they can go to our website.
mhwcaustin.org.
And in that website, you'll see information about sponsorship. And you could sponsor at any level. We don't mind if you want to just give $10 to support the work that we're doing. We'd love it. We'd love we've had some big sponsors, like Texas Mutual has been a fabulous sponsor for us in the last several years. But we need others to really continue the work that we want to do. So, and if somebody wants to volunteer on a committee, because we have quite a few, like we have a communications committee, an events committee, fund development committee, we would love to have you serve in that way. And if you have,
Yeah.
if you're interested in participating, we will find a place for you.
So, Mary, in addition to volunteering and getting involved themselves and donating, are there businesses that are part of the Health and Wellbeing Council that our listeners can support to then further help them support you?
Yes, we have so many wonderful organizations that have become partners, like the American Heart Association, like Ascension Seton, Austin Community College, Austin ISD, City of Austin, Foundation Communities, Integral Care, People's Community Clinic, Samsung, the Health and Human Services Commission. So I can go on and on. We've got quite a few, Whole Foods, the University of Texas, St. Edward's University, Texas Mutual, the YMCA, lots of great organizations that have become partners. And so they're demonstrating that they believe in the health of those that work with them, and they believe in the health of the community and wanting to keep the community healthy. So, yeah, great organizations to support.
Awesome. Well, thank you so much for taking the time to share the Mayor's Health and Wellbeing Council with us. And thanks for being there and volunteering and being willing to be one of the people that made it happen.
Well, thanks. It's been a fun journey, and yeah, it's been a long journey, but I'm proud of what we've been able to accomplish.
Thank you for joining us for this episode of Generous Impact with Dr. Mary Faria. If you'd like to learn more about the work of the Mayor's Health and Wellbeing Council, visit mhwcaustin.org. We'll be back soon with more conversations about people making a difference in their communities.